This patient had come from Sudan, and he is a known case of trauma wherein his spine had a fracture and he had complete paralysis, which for which he was operated, but then he did not improve. And the outcome was that he was on a wheelchair and he could move his limbs very slowly and incompletely. So when he came to us, we evaluated him completely, and we found out that the implants were in a wrong place, and there was significant amount of neural injury. So we went ahead and removed the implants which were in a wrong place, actually, because the fracture has been enough old and he did not require any other further fixation. So we opened it further, did neurolysis, and after the neurolysis, the wound healing took place, and he was on a rigorous physiotherapy schedule with the help of medications and diet and neuro rehabilitation. Today he stands with the calipers, and he also walks with a walker on his own. So this kind of result in such injuries is really good, appreciable, and really loved by the patients and their attendants. But normally they are just written off by most of the doctors in their countries when they come to institutes like ours. They get the best of the advices, and when they get those advice and they follow it, and the rigorous, it is inclusive of the rigorous neuro physiotherapy, these patients do improve, but it is not a standard. These kind of improvement are rare, and yes, the candidate has to be a right candidate to do a procedure and the supportive therapy. So he's standing after 3 weeks of his surgery, and he has also undergone trial implantation, and he is a good candidate for dorsal cord stimulation for the future. So now he goes to his country, back to Sudan, and he'll be followed by me there in the OPD. And if we think in future that at all, if he requires, then we do a dorsal cord stimulation, which will help him further in terms of his bladder and bowel control, which is also partially controlled as of today. And his life would become further better, and that is what the clinicians and the medical science should do to such people, and we are very happy to treat such patients.